Hello everyone, my name is Chong, and today I'll be going through the evaluation of a chosen eHealth product, the Apple Watch, and specifically the heart rate monitoring feature. The heart rate monitor in the Apple Watch has two main features, one that is PPG-enabled monitoring and an electrical sensor that takes an ECG similar to a single-lead ECG and uses machine learning to look for the presence of atrial fibrillation. I will start off with going through the search strategy. A desk research was used as the search strategy, and research topics consist of Apple Watch, heart rate monitor, ECG, wearable heart rate monitor, and heart rate monitor use cases and accuracy. Sources include Google Scholar, IEE Explore, PubMed, and of course Apple's website, and grey literature around similar topics. Let's talk about the main features of the heart rate monitor in the Apple Watch. The ECG app can capture heart rate rhythm on demand in a moment when users experience symptoms such as a rapid or skipped heartbeat and help provide clinically important data to physicians. The irregular rhythm notification feature on Apple Watch occasionally checks rhythm in the background and sends a notification if an irregular heart rhythm that appears to be atrial fibrillation is identified. Left untreated, AFib is one of the leading conditions that can result in stroke. Now, let's look at the technical design of the watch. Taking an ECG recording is as simple as launching the ECG app on the watch and touching the power button on the watch called the digital crown, which completes the circuit and allows electrical signals across the user's heart to be measured. The ECG app on the watch uses machine learning algorithms to classify the user's heart rhythm as sinus rhythm or atrial fibrillation or inconclusive. All recordings, their associated classifications, and any noted symptoms are stored securely in the Health app on the iPhone, from which users can share a PDF file of the results with physicians to provide care to patients. Now, let's shift our focus to the background information of wearable devices and heart rate monitoring. Over the past decade, there has been an explosion of consumer devices for the purposes of health and fitness tracking. It is estimated that the use of wearable technologies will increase by 3 times, with an estimated of $50 billion in annual sales in 2018 alone. Exploratory studies in atrial fibrillation detection using wearable technologies have been limited to small studies using a single wearable device. Currently, most wearable devices monitor heart rate through photoplasmography (PPG) that detects blood flow through the wrist. However, PPG-based monitoring does not provide electrocardiogram information and has intrinsic limitations in their accuracy and noise filtering. The dominant domain of research has been a focus on the utility of wearable technologies for the detection of atrial fibrillation. The Apple Watch alone effectively distinguishes between sinus rhythm and atrial fibrillation in patients undergoing electrical cardioversion of atrial fibrillation. Other studies have evaluated the utility of atrial fibrillation screening using handheld devices such as AliveCor Cardia, which is FDA approved. However, it has also demonstrated high accuracy that is comparable with the Apple Watch. However, 1/3 of data recordings require a physician interpretation and cannot be interpreted by the Cardia algorithm. This enabled continuous remote patient monitoring, and studies have shown to reduce hospital and emergency department visits, early detection of atrial fibrillation and stroke, and overall increase patient satisfaction. Next, let's jump into the benefits and limitations of the heart rate monitor of the Apple Watch, evaluated based on 5 themes extracted from the KDS framework. Let's start off with health service outcomes. Benefits include improved diagnosis and treatment of disease conditions, greater flexibility and control by patients, which means patients no longer required to pay a visit to the hospital every time they need a heart rate monitor, and they are free to continue on with their daily lives knowing their healthcare provider or themselves will be notified of any irregular heart activity. These devices overcome barriers of traditional healthcare delivery, empower patients, and provide opportunities for atrial fibrillation screening in the general public due to their widespread adoption. Unfortunately, the ECG app in the Apple Watch is only available in the US, Europe, and Hong Kong. Next, technology outcomes. Benefits. The ECG app is safe to use and FDA cleared in the United States in 2018 and Europe recently this year. The overall design of the watch has been highly rated among physicians and users. It is convenient, easy to use, and provides a pleasant user experience. The Apple Watch is also found to be more accurate and reliable than other comparable devices on the market, such as the AliveCor Cardia I mentioned earlier. However, it is not cleared for use in most Asia-Pacific countries, and the interoperability needs to be further explored. For example, a patient would be required to use an iPhone in addition to the Apple Watch to access all the functionality. Moving on, behavioral and social technical outcomes. The Apple Watch ECG app is expected to educate patients and motivate individuals toward better habits and better health, and this can be done at scale with a high adoption rate of the device. On the flip side, access to too much data and constant data collection could cause unnecessary confusion and concerns among patients. The Apple Watch has done a good job of ensuring the security and privacy requirements of the patients are met. Patient data are encrypted and stored on device over the cloud, and authorized physicians would have access to patients' data. Lastly, the cost of an Apple Watch is usually incurred on the patients, and it is relatively affordable for an existing iOS user, taking into account all the features that come along with it. However, it can be expensive for users who are not already part of the ecosystem. To wrap up, let's go through the recommendations and predictions. The use of wearable and continuous patient monitoring will increase at scale, and Apple has announced plans to expand and seek approvals from international regulatory bodies and make the ECG app available to more markets. I would also recommend improving the reliability and accuracy of the heart rate monitor, support management of chronic disease, and real-time connectivity and feedback between patients and physicians. Lastly, wearables have the potential to become truly disruptive in the healthcare sector, with large segments of the population seem to have readily available health data that a physician must interpret. We should benefit from advanced usage of artificial intelligence and machine learning to interpret, understand data collected, and improve overall care for the patient. Thank you very much.